Good afternoon, ladies. My name is Megan. I'm a nurse practitioner at the office. What is your name?
Amanda, nice to meet you.
Nice to meet you, Amanda.
Hi, I'm her mother, Nicole.
Nice to meet you, Nicole. And just to verify, Amanda, can you tell me your last name and date of birth?
My name is Amanda Levonic, and my birthday is 8/5/91.
Okay, wonderful. And now what seems to bring you ladies in today?
Well, I'm a first-year nursing student, so I'm extremely overwhelmed with schoolwork and everything.
Mm-hmm.
And I've been noticing that whenever I settle down at my desk before I start studying, like I'll notice my pillows need to be a certain way, or things on my dresser aren't where they should be, and I have no choice but to get up and fix them.
Okay.
Because otherwise I'll just sit there and be anxious and kind of go stir crazy.
And I've noticed something was up. She's been asking me to wash her sheets about 3 times per week, just because she sat in her bed before cleaning her clothes.
Okay, now how long have you been experiencing these feelings?
Well, before the semester, like I've noticed little things that bother me like that. Like I have to turn the light on and off a certain amount of times, but I just do it. Don't really think about it.
Okay.
But ever since the semester started a few months ago, it's just been getting worse and worse and worse. And if I don't, like I'll try to not think about it really hard, but if I don't, like I'll get extremely anxious and it drives me crazy. I have to go and fix the problem, and it'll take me like a half hour, and I'm exhausted after and kind of just can't get my thinking straight and study.
Okay.
And I feel so bad. I try to help her, but every time I try to help her, she needs to do it a certain way, so I'm just in her way. Her grades have been suffering, so that is why we came in today.
Okay, well, I'm very glad that you did decide to come in today. It must be very debilitating to have these feelings brought on, especially when you're in school and everything. I want to discuss with the physician, discuss some of these side effects discuss some of these symptoms that you're experiencing and see what we can do for you today. Just give me one moment.
Okay, sounds
All
good.
right, thank you so much.
I'm tired.
How do you feel?
Yeah, she's right.
Hopefully the doctor has something.
Yeah, we'll see.
Mhm. Thank you so much, ladies, for being so patient. I did just finish up collaborating with the physician, and we decided that we would like to start you on Fluvoxamine for your symptoms. It's also known as Luvox. Have you ever heard of this medication before?
No.
Okay, well, it's a type of SSRI, and it's commonly used to treat symptoms of OCD or anxiety, which seems to be what you've been experiencing lately.
Mm-hmm.
All right, now I'm going to start you on 50 milligrams by mouth. It's going to be taken at night, once daily. It really does take about 2 to 3 weeks to really see any kind of effect with this medication. It takes about a month to have its full effect. So I am going to encourage you to make an appointment to come back and meet with me in about 2 weeks to see how you're doing with this medication.
Okay.
Do you have any questions for me?
Are there any side effects that we should watch for?
Okay, so most commonly with the Fluvoxamine, the side effects you may see would be some dizziness, drowsiness, insomnia, sometimes dry mouth or constipation. Also, Mom, I'm going to encourage you to look out for Amanda's any changes in her mood. While the medicine is trying to kind of balance out in the body when it's first introduced, it does have some effects on the mood, so we do want to keep an eye out on that. Are there any other medications that you're taking currently, Amanda?
I am on birth control.
Okay, well, it's very important then that you remain on your birth control. You take it regularly. Also, if you are sexually active, I am going to encourage you to use a second form of birth control as well, because this medication does have dangerous effects on pregnancies. Any other questions for me regarding this medication?
I mean, I am a college student, so I do go out drinking with my friends sometimes. And like, am I gonna like black out from this or anything?
Okay, well, I do appreciate you sharing that with me. I am gonna say that with this medication, you do want to avoid alcohol. You also want to be careful with caffeine as well. Both caffeine and alcohol have negative effects while being taken on this medication.
Okay.
Now, to ensure that you understand everything that we've discussed this afternoon, I'd just like to go over and see what you guys have taken from this conversation with me.
Okay. Well, she is going to stay on her birth control.
Yeah.
She will use a second form if she is sexually active, and I am going to watch for her mood changes in the first couple weeks.
And I'm gonna make sure I take one pill before bedtime, and then when we follow up with you in 2 weeks, we'll go from there.
Absolutely, yes. We'll see how the medication is working in 2 weeks. We may decide at that point to increase from the 50 milligrams, but we'll see how it goes in 2 weeks. Any other questions for me, ladies?
That's it.
You can certainly reach me at the office. I'm just going to leave you with this pamphlet as well.
Thank you.
Just have some details regarding OCD, some of the anxiety you're feeling. There are some details regarding the medication as well.
Okay.
All right, it was a pleasure meeting
Thank
with you,
you.
ladies.
Thank you.
Thank you so much.
Bye.